Our gifts and endowments are blessings from God, and we must never take our blessings for granted. In fact, we should take care of whatever we are being given. For example, our minds and our body. In fact, we should have self-love and self-care, because if we don't, how are we able to care for others? My name is Elizabeth Lee, and this is my story.
It's 2022. Half the population are women, and yet so many of us are uncomfortable discussing the truth about our bodies, about how they work and how they don't. And that's why we're celebrating Her Stories, a series that explores the physical, emotional, psychological, and social forces that influence female bodies and how we can strive for better health and happiness. This series, we interview real amazing women who have all gone through life-changing experiences. This special series was brought to you by Sunway Medical Centre in conjunction with International Women's Day. In this episode, we'll be discussing aging amongst Asian women and how it can affect women physically, emotionally, and mentally, and how we can maximize our life later on. And to discuss this topic, we have two very special women here on set with me. We have Professor Elizabeth Lee, Chief Executive Officer of Sunway Education Group. Hello, Professor.
Thank you very much, Cheryl.
So lovely to meet you. And also as impressive, we have the lovely Dr. Wendy Lim, who is a gastroenterologist as well as hepatologist at Sunway Medical Centre. Thank you for coming today.
Thank you very much. I'm glad to be here today.
Yes, we are discussing aging today amongst Asian women, which is a topic that I feel is not discussed enough and also a little bit of a taboo amongst women in Malaysia. But before we dive into that, Professor Elizabeth, I wanted to ask you, what does identity mean to such an accomplished woman such as yourself?
Identity. I think it would be about knowing oneself. Sure. For me, definitely finding my identity is finding myself.
Right. What keeps you motivated and what drives you to keep trying on new things as the years go on?
Well, for me personally, again, there's just so much going on in the world.
Yes.
You know what I mean? Every day there's something new, and to be alive and to be able to continue to experience and to live. I did say about, how it changes every decade and how we react to life also changes. And that's also because we become more experienced, and because we ourselves change, whether it is our body, our energy level maybe. I find that as I'm growing older, that I'm a lot more driven.
Right.
Yes. Yeah, and there is this drive to need to do a lot more, to live a lot faster. I'll give you an example. I've always wanted to skydive.
Oh, wow.
Yeah, when I was very young. Of course, my parents would said, no way, you're not skydiving, So I did it a few years back.
You did not?
I did, with my daughter.
That's amazing. I would never actually do it, even if I was brave enough.
That's great fun. Yeah.
Yes, I can imagine.
Yeah, but we just regretted the way we looked coming down,
The wind tunnel look and
Yeah,
great for the hair.
That's right.
Professor Elizabeth, I don't think anybody can look good coming down. Your face distorted,
Exactly. Very distorted. It's like, where's the Instagram picture?
That's lovely. That's such a lovely story.
Yeah.
Is there a correlation between diet, lifestyle, and mobility?
As one gets on, I think there's no doubt that our mobility will decrease with age because our muscles become weaker, our bone density becomes less, our joints become less flexible. And then for some of us, maybe unfortunately struck down by illnesses.
Yes.
Right? Maybe arthritis, neurological disorders like Parkinson's, stroke, Alzheimer's, right?
Yes, absolutely.
Or heart conditions. So all of that can affect our mobility. And sometimes for someone, let's say, who's been active all their life, as they get older, if whatever reasons their mobility gets impacted, it does affect them emotionally, as you can see, right? They may get a depression, some anxiety,
It's just a loss, it's just a
Yeah.
losing control of your own body.
Correct.
It's a scary thought.
I mean, it just one thing leads to another. You get social isolation, loneliness. All of that just spiral down. So, yeah, I think keeping one active as one gets older is really important. And I think these are the habits that I think we should start cultivating. Not when we hit 50 or 60, but from 30 years upwards, for instance. I think we need to start to be a bit more aware about the need to be physically active.
Absolutely.
Yeah.
Absolutely. With aging, because we lose control of our bodies, as you say, and we lose our youth and then inherently our beauty. So what would your advice be for a woman who's going through something like this, who is petrified of aging?
I remember when I was in my 20s and my friend was concerned about being 30. And I said, "Are you crazy? And why are you so concerned about turning 30? He says, "Oh, I'm quite petrified." It's a man.
Right.
And he said that it's because he just was, and it was just 30. And to me, it was like, wow, I'm finally going to be 30,
Yeah, what a milestone.
I'm going to be grown up, because truly in my 20s, you're just finding yourself, as you mentioned earlier on. And then my 30s is like when I'm a little bit more settled. You feel that you know what you're doing in your career. Yes. And then, of course, the 40s, when you mentioned 40s, I'm smiling to myself. I remember the 40s is just great. The children are just coming up, and enjoying them, being able to take them out with you and not having to bring diapers or anything along. And and have a decent conversation. And then, of course, the 50s, wow, you feel that you know it all, I've been there, done that. Yes. And now in my 60s, oh gosh, I can afford to be acid auntie. I love that, yeah.
As like my aunties always say, right? At this age we can do and say anything we want.
Exactly, there's nothing to be fearful about aging at all.
So we're going to go to a subject on Dr. Wendy's specialty. We need to discuss a little bit about microbiome health. What exactly is it and what it entails?
Gut microbiome is a collection of bacteria, viruses, fungus, protozoa that coexist in our intestines.
Okay.
It's a complex ecosystem, but it keeps our gut health ticking away. It performs very vital functions. For instance, it gives protective function to the gut with pathogen displacement, antimicrobial peptides productions, structural functions like barrier fortification, metabolic functions like fermentation of non-digestible products, digestion of our complex carbohydrates and fats. So these are very vital functions for the intestines. Of course, there are factors that can disturb this equilibrium, one of which is sadly age, coexisting medical illnesses, medications that we consume as one gets older because of our coexisting medical illnesses, right? And diet. So therefore the composition, of the gut microbiome in the young versus the old is different. In the older patients, it may be less diverse in population and composition. So this becomes dysbiotic. And what happens is that it can trigger inflammation. By, let's say, leading to sort of activation of pro-inflammatory cytokines.
What happens when there's inflammation?
So when there's inflammation, it makes perhaps the gut more susceptible to pathogen invasion, toxins going into our bodies. So you're more likely to get perhaps infections, maybe cancers.
I see.
One of the adverse side effects, of a dysbiotic microbiome is the disruption in the synthesis of important metabolites, one of which are things like short-chain fatty acids, which has anti-inflammatory and anti-cancer properties.
Right. So your gut microbiome will change as you age, but how do you look after yourself?
I think a healthy diet is critical, important. Eating a balanced diet, not wholly meat-based or just plant-based. I mean, to me, I'm an advocate of a balanced diet. right? And avoiding excessive processed foods, sugars, alcohol, and smoking. I think if you stick to the limits, it's fine, but not like a bottle a day. I mean, that would be excessive. A glass of wine a day is perfectly fine.
Professor Elizabeth, how diligent are you when it comes to your annual screenings?
Very diligent.
Good.
Yes, I think it's important to keep up with your screenings, ensure that you know exactly where you need to, take more care over, and to get it right.
That's right.
Before, any harm is done.
Early detection.
Absolutely, yes.
Yes. What do you think?
I mean, I totally agree. I think preventative medicine is really important. We're talking not just about, screening for the usual cancer, but, other diseases are equally important, like screening for possibility of getting diabetes, cholesterol problems, high blood pressure, cardiac diseases. Then, of course, on the cancer side, for the women, everyone knows about the Pink October month for breast cancer screening.
That's right.
So the option to start breast cancer screening, from the age of 40 upwards on an annual basis.
Yes.
And then after 55, the option can be 1 to 2 years.
Okay. Looking at the both of you, looking so healthy and energetic and full of life, I'm just curious about what you do in your daily life to keep up with your health in terms of exercise or diet. What is your secret?
For me, I keep very busy.
Okay, and busyness keeps you young. Yeah.
Very busy. Don't know whether busy body or what busy, but keeping yourself busy with work, with things that you like to do. And it helps that if you like your work, it's perfect.
Right.
And in my case, I do like what I do, so it just suits me so well. Yeah.
And that works. How about you, Dr. Wendy?
Yeah, I mean, I do enjoy my work. People may find it strange why I like poking to people's gut, but I do actually enjoy it. It's challenging at times, and being a doctor, you actually come into contact with a lot of people from across the social spectrum, and I find it really interesting to talk to them, not just about their diseases as well, but I think as a doctor, it's also important, like maybe being a bit busybody, find out what's going on with their lives, whether some of that can actually have an impact on their physical symptoms.
Yes, exactly.
And I think not just being mentally fit, I think physical fitness is also important, right? Both go hand in hand, I think. So I try to make sure I exercise, almost every day.
Thank you so much, ladies, for joining me in this series about this topic that actually I feel is extremely important for us to discuss, and having you two come on set today to discuss this with us is a big honor. Thank you very much.
Thank you. Absolute pleasure.
Thank you for having us.
You can share your stories too on #SunMedHerStories, and you never know if you could be helping someone who's watching today. For more information on our guest as well as women's health, head on to our website. See you in the next video. Bye.